Hello, welcome to ANA community. In this particular video, we are going to discuss the concept of Roga Nidana learning to heal. When you think about the learning to heal, it is nothing but the concept of the different areas where a student has to give the concentration. So here, the Roga Nidana learning wheel, it is nothing but the 8 areas of the learning the subject where a student has to give the concentration or has to give the stress. So those 8 areas are being depicted in this particular small wheel. Let us learn from that the left, right to left in that way. Dosha in the clockwise direction. Dosha, Nidana, Roga, Rogi, terminology, Roga Marga, pathophysiology, and PCB. That is physics, chemistry, and biology. So each aspect, when you think about these learning wheel, we'll look into one by one. When you think about the term dosha, which is nothing but bioenergy, we need to say which type of dosha is being vitiated in the body. Whether is it sharirika dosha or manasika dosha. Sharirika dosha in the sense there may be a possibility of vitiation of either vata dosha, pitta dosha, or kapha dosha. Or in case of the manasika dosha, there may be a possibility of vitiation of rajo dosha and tamo dosha. Based on the lakshana observed in the patient, we need to identify which particular dosha is being vitiated. Further, we need to know whether this particular dosha is being in the increased state or decreased state, or whether it is in the normal state. Increased state in the sense, when the person is having the constipation, we may say that the person is having the increased or abnormal increase of vata dosha. If the person is having the excessive salivation, we may say that the person is having abnormal increase of a kapha dosha. But we may say there may be a possibility of a decrease of a vata dosha also in that particular situation. So like that, further, when you think about the dosha, whether this particular dosha is present in the koshtha or shaka or marma, asti or sandhi, etc., that has to be known. When the person is having the excessive consumption of the food substances, there may be a possibility of vitiation of the dosha specifically observed in the koshtha or mahasrotas, or what we can say alimentary canal. Further, we need to know whether the any kind of the guna vriddhi in terms of the dosha. For example, vata dosha is having ruksha, shita, laghu, khara, sukshma, chala, and anila. Which particular guna increased in the body, that has to be known. Whether is it ruksha guna increase, or whether is it the shita guna increase, or whether is it the laghu guna increase, etc. That has to be known. Further, we need to know about the karma vriddhi, which particular karma is specifically increased in the body. For example, if the person is having the diarrhea, we may observe the chala guna of vata dosha will be abnormally increased. Whereas the person who is suffering from vibandha, or what we can say constipation, there may be a possibility of a chala guna kshaya, but there may be a possibility of ruksha guna vriddhi that may be observed in that particular individual. So like that, we have to know, we have to apply the concepts in terms of the dosha. When you think about the next point, that is nidan, which particular nidana is increased in or exposure is being present by the individual. For example, व्यायामाद अपतर्पणात् प्रपतनात् भंगात् क्षयात् जागरात् वेगानां च विधारणात् अतिशुचः इत्यादि अतित्रासतः रूक्षक्षोभकषातिक्तगटुकैरेभिः प्रकोपं रजेत् वायुर्वारिधरागमे परिणते चान्यपराह्ने अपि च. When you think about this particular nidana exposure, we may say that the person is having the abnormal increase of vata dosha in the body. If the person is having the increase of the dadhi as such, we may say that there may be a possibility of abnormal increase of pitta or kapha dosha in the body can be predicted. Further, the differentiation of this will be if the person is consuming amla rasayukta dadhi, there may be a possibility of abnormal increase of pitta dosha. If the person is consuming the madura rasayukta dadhi, there may be a possibility of abnormal increase of kapha dosha in the body. So, like that, the application of this will be helpful in determining the which particular nidana is being exposed in the body. Sannikrishta hetu as such. The term Sannikrishta hetu, as per Madhukosha, it is nothing but the Vata, Pitta, Kapha, etc. Suppose if the person is exposed to Vyayama, we may say that there may be a possibility of the Sannikrishta hetu. In this particular example, Vata dosha may be abnormally increased. Regarding the Asatma Indriyartha Sanyoga, Prajnaparatha or Parinam, we have to know which particular the Nidana is being exposed by an individual. Depending upon that, we may say that there may be a possible disease manifestation. As far as source of entry of Nidana is concerned, which particular srotas is being exposed, whether is it the mouth or whether is it nose, ears, eyes, vagina, anus or urethra, breast, etc. Source of entry of Nidana may be that, or which particular the Nidana, regarding the number of Nidana as such, how much number of Nidana is being exposed or entering into the human body. Less number, milder form of disease, more number, more severe form of disease may be possible. Virulence of Nidana. If the virulence of Nidana, if less virulent Nidana, milder form of disease. If more virulent Nidana, there may be severe form of disease may be manifested. What type of Pura Rupa is being observed? What is the Rupa that is being present in an individual? And what do you consider to be a Samprapti as such that is happening in the individual? And based on that, where actually the dosha is being located, that has to be known. All these are coming under the purview of Nidana as such. So the term Nidana, there are two categories, either the Vyadhi Janaka Hetu, that is what we can say the exact etiological factors, and Vyadhi Bodhaka Hetu, that is Nidana, Pururupa, Rupa, Upashaya, and Samprapti. That is considered to be the Nidana Panchaka as such. Both are considered to be the word Nidana as such. When you think about the Roga, so anything that is considered to be responsible for the discomfort, of course, that is having the harmful effect to the body, that is categorized under the heading of Roga. We need to know regarding whether is it Sharirika Roga or Manasika Roga. When you are observing Vata, Pitta and Kapha dosha dominant manifestation of disease, then we may say that Sharirika dosha, Sharirika Roga manifestation, whereas Rajo dosha and Tamo dosha dominant diseases as such, then we may say he may be suffering from Manasika Roga. Further, regarding the Roga, we need to know whether it is Rasagata or Raktagata, Mamsagata, Medogata, Asthigata, Majjagata or Shukragata or Mutra, Purusha or Swedagata as such. We need to know about whether the Vyadhi is considered to be Shakhagata or Kushtagata or Varma Asti Sandhigata as such. Whether the person is having Mrudu or Dharana Vikara. In the sense where the person is having the Rogi Bala more and Roga Bala less, then we may say he may be suffering from Mudhu Vikara. Wherein if the Roga Bala is more and Rogi Bala is less, then we may say that the person is suffering from Dharana Vikara. And when we are going to say whether the person is suffering from Sadhya Vikara or Asadhya Vikara, when the person is having the milder form of the Hetu exposure, then we may say he may be suffering from Sadhya Vikara. And if the person is having the presence of Arishta as such, then we may say that he may be suffering from Asadhya Vikara. Further, we need to know about whether the person is having either Adhyatmika Vikara or Adhibhautika Vikara or Adhidaivika Vikara. So, when the person is having the self-induced diseases as such, or diseases which are manifested due to the ill deeds done by oneself, then we may say that he may be suffering from Adhyatmika Vikara. When the diseases are manifested because of the deeds done by others or animals, etc., or weapons, etc., then he may say that he may be suffering from Adhibhautika Vikara. Or when the person is afflicted with the diseases which are beyond one's control, they are considered to be Adi Daivika Vikara. Further, we need to know about whether the person is suffering from Adi Bala Pravutta Vikara or Janma Bala Pravutta Vikara or Dosha Bala Pravutta Vikara or Sanghata Bala Pravutta Vikara or Kala Bala Pravutta Vikara or Daiva Bala Pravutta Vikara or Sobhava Bala Pravutta Vikara. So, whether the person is having either Sama or Nirama Avastha, that has to be known. Because when the person is suffering from Sama Avastha, you cannot administer the Shodhana procedure as such initially. We have to go for the Deepana Pachana, Pachana and Deepana, then we have to go for the Shodhana therapy as such. Of course, we have to consider the Rogi Bala first, whether he is able to withstand the potency of the medicine, that has to be known. Further, whether the person is suffering from either Pranavah Srota Vikara or Annavah Srota Vikara or Udakavah Srota Vikara, etc., has to be documented. And whether the person is having either Nija Vikara or Agantuja Vikara, whether the person is suffering from Amasha Samutta or Pakvasha Samutta Vikara, that has to be recorded. When the person is having either the Pitta or Kapha dominant diseases, then we may usually say that he may be suffering from Amasha Samutta Vikara. And when the person is having Vata dominant diseases, then we may say that he may be suffering from Pakvashaya Samutta Vikara. This is how we have to know about these particular aspects in terms of the Roga as such. When you think about in terms of the Rogi, that means the individual is suffering from the diseases, we have to know about what are the characteristics of the Rogi. Adhyo Rogi Bhishadvasho Jnapakah Sattvavan. So that is the characters of Rogi is being mentioned in Charaka Samhita. He should be able to would purchase the medicines as such. Bishagvasha, he should be what do you say that submissive to the patient, the physicians as such. Jnapaka, he should be thinking about knowing about his discomfort properly. He should be in a better position to narrate this their discomfort to the physicians. Sattvavan, that means he should be able to withstand whatever may be the potency of the medicines he is being exposed to. That has to be he has to withstand that. Those are the characters are there. If they are present, then we may say that he may be having the what do you say that we can able to say that he may be getting the cure from the illness in the short possible amount of time. How to identify the status of the Rogi? So that is how to identify the Rogi Avastha or Vyadhi Avastha in an individual. He is having the Sama Avastha or is having the Nirama Avastha, etc. That has to be known. Which particular part of the body is being afflicted? Whether is it the Sandhi is being affected, or whether is it Marma is being affected, or whether is it Koshta is being affected, or whether is Shaka is being affected, or whether is it Rasadat is being affected, or whether is it Urdhva Shaka or Adha Shaka, or Uras or Udara is being affected, or Shiras is being affected, etc. So that is the status, of the Rogi, which particular part as such that is being affected, that has to be known. How to analyze the Prakriti of an individual. So that means whether what kind of the physical characters are there, what are the mental characters are there, what are the emotional factors of an individual, how to analyze social or spiritual aspects. So all these are coming under the category of a purview of Prakriti analysis. What kind of the Sara is being having, whether the person is having Twaksara Avara or Raktasara Avara or Astisara, Avara or Madhyama, or Majjasara, Avara or Madhyama, etc. That has to be analyzed. Then, how to analyze the Vyayama Shakti of an individual? So, that is Balam Vyayama Shakti. That is, physical strength of an individual can be assessed by this. How to do Aptopadesha Pariksha? How to interact with the individual? How to gain the necessary or required information from the individual? That is the main skill that has to be learnt by Yogi Pariksha itself. How to do Nadi Pariksha of an individual? So there are certain situations where we can able to assess the overall health status of an individual by simply examination of Nadi itself. So for that, the skill has to be developed only if you are knowing about the Rogi Pariksha properly. How to assess the Sadhya Sadhyata of an individual? For example, it is being mentioned, Etavaha Puru Rupani, Rupani Alpani Yasyacha, Nacha Tulya Gunam Dusho, Nadoshaha Prakritir Bhave, Nacha Kala Gunastilyo, Nadesho Durupakramaha, Dhatirekaanavatvam cha Rogasyopadravo nacha, Doshashchaikah Samutpato, Deha Sarvaushadakshamaha, Chatushpadopapattischa Sukhasadhyasya Rakshanam. This is how we can assess the Sukhasadhyata of the illness in an individual. So, like that, the Sadhya Sadhyata assessment can be done by knowing about the Rogi Pariksha itself. And regarding the Sattva assessment, so whether the person is having Pravara Sattva or Madhyama Sattva or Avara Sattva in the sense he will be influenced by the other persons even for the slightest reason. That means they may not be knowing what their values are. They may not be knowing what their beliefs are. Whereas Pravarasattva individuals, they are knowing exactly what their values are, what they are doing, where they are going, etc. What is their end goal, etc. The Pravarasattva individual, they may be knowing their end points very well. How to identify the Satmya of an individual? Whether the person is having Ekarasa Satmya or whether the person is having Dvirasa Satmya or Sarvarasa Satmya, etc. That has to be known. When you think about the concept of the terminologies, area of terminologies, there are certain terminologies that are being mentioned in Sanskrit language that has to be known properly. What actually its meaning is, what will be the extent of that particular meaning, what will be the impact of that on the learning as such, what will be the impact of those different word meanings, how to understand that. For example, Dadhi. What actually Dadhi means? That is curds, or what we can say, the Dahi in Hindi. As such, so there are the word meanings. What actually that is, that has to be known. Kshira Vikriti. The term Kshira Vikriti, they are, that may be either dahi, or either that may be either buttermilk, that may be either butter or ghee, etc. So that has to be properly mentioned. That is the some kind of sweet preparations made out of milk, etc. Navanita, that means the butter. And Sramsa, it is considered to be a Vata Prakopa Karma, wherein the dislocation of the part of the body may happen. Swapa, that is the numbness of the part of the body. The Rudrasi, it is the disease that is being mentioned, which is considered to be responsible for the pain which will be observed in the one lower limb. Vata Rakta, it is the disease where there will be Vata dosha increase and Rakta dosha affliction is being seen. That may be some kind of the disorders that is considered to be the joint afflictions or otherwise the blood afflictions as such. What we can say, the connective tissue diseases, they are being categorized under this particular aspect. Arishta. So as such, the term Arishta that is being used even in Rasa Shastra and Bhaishya Kalpana as such, where there will be the preparations, but here they are considered to be the signs of imminent death. Samprapti, that is the actually the nature of a pathogenesis, that is pathological events that are taking place in the body. When the we need to know about what actually the area where there is dosha vitiation that has been taking place. What is the initial event? What is the subsequent event? What is the next third subsequent event? In which way the vitiated dosha is moving inside the body? Everything that has to be known by learning this particular concept of samprapti itself. Regarding the satya sadhyata, how far the disease is curable and incurable, what are the different factors that are considered to be responsible for the curability of illness in terms of hetu, that is etiological factors, in terms of pururupa, that is prodromal symptoms, in terms of the rupa, that is the main clinical features, etc., in terms of upashaya, that is the trial and error method. We are going to make the confirmation or rejection of the diagnosis as such. So that is the we need to know about this particular terminology. And terminology of Sruta Dushti, what actually the Ati Pravritti is. When do we say the person is having the Ati Pravritti? Whether is it excessive vomiting, is it considered to be Ati Pravritti? No. The person who is having the excessive movement of the fecal matter, it can be considered as Ati Pravritti. Excessive urine formation, it is considered Ati Pravritti. Excessive menstrual flow, in its that is considered to be ati pravritti. As such, that is the word meaning of what actually Srotadushti is. So that has to be properly known. And when you think about the concept of Roga Marga, we need to know what actually the word meaning Roga Marga is. So that means we have to know about source of entry of the pathogens. They are being taking place in the Bahya Srotas. So that means whether is it taking place in the mouth or whether is it taking place in the nose or eyes, ears, or in the urethra, anus, vagina, or breasts as such. So in that way, the person is suffering from Abhyantara Roga Marga Vikara. There may be a possibility of source of entry of pathogen will take place either through the mouth itself, but to a lesser extent, there may be a possibility of a nose as such entry. So in that way, which particular Rogamarga affliction is being seen? Whether is it Bahya Rogamarga affliction, or whether is it Abhyantara Rogamarga affliction, or whether is it Madhyama Rogamarga affliction, injury to the knee joint, we may suspect to the affliction of a Madhyama Rogamarga. Or the person who is having the head injury, we may suspect the Madhyama Rogamarga affliction. Injury to the lower abdomen, where there is a trauma happening to the urinary bladder, we may say Madhyama Rogamarga affliction. The person who is having the excessive consumption of, what do you say, that the too much spicy substances may lead to vomiting, Abhyantara Rogamarga affliction. The person who is wearing the necklace, developing the itching around the neck as such, we may suspect Bahya Rogamarga affliction. So like that, which particular Rogamarga affliction is being seen, we have to know. So that means we have to identify the nature of movement of this particular vitiated dosha is happening in the body has to be properly recognized. How to identify the sequence of Rogamarga afflicted? Initial, that means sequence in the sense there are basically three Rogamarga are there: Bahya Rogamarga, Madhyama Rogamarga, and Abhyantara Rogamarga. Whether the person is having the initial affliction of Abhyantara Rogamarga, then Bahya Rogamarga, or then Madhyama Rogamarga, or otherwise initially Abhyantara Rogamarga affliction, then Madhyama Rogamarga affliction, and later Bahya Rogamarga affliction. So like that, the sequence of Rogamarga affliction has to be known by looking into the presenting complaints as such. Is there any possibility of Rogamarga involvement first? So that has to be properly known. For example, while riding the bike, so meeting with an accident, knee joint is being injured. Here we may say that the person is having Madhyama Rogamarga affliction. So in that way, we have to know about this by knowing about the proper presenting complaints itself. And the extent of each Rogamarga type. In the sense, the Abhyantara Rogamarga is having the five main components: mouth, esophagus, stomach, small intestine, and large intestine. So, if you are observing the affliction of the stomach itself, we may say that extent of Roga Marga affliction, Abhyantara Roga Marga is limited. The person is having the affliction of stomach, small intestine, large intestine, then we are going to suspect the lower alimentary canal. The extent of Abhyantara Roga Marga affliction is limited to lower alimentary canal. If the person is having vomiting, pain abdomen, diarrhea, etc., then we may suspect the affliction of a whole Abhyantara Rogamarga affliction. So, in that way, the extent of Rogamarga affliction has to be properly identified. In terms of Bahya Rogamarga, so whether is it the intravascular compartment or interstitial compartment or intracellular compartment of skin, part of the skin is being affected, then the limited Bahya Rogamarga affliction. So nearly around 50% of skin is being affected. Then we may suspect the moderate affliction of Bahya Roga Marga. 90% of the affliction of skin, then we may suspect the more intense the Bahya Roga Marga affliction can be predicted. In terms of Madhyama Roga Marga, if one joint is being affected, then we may say that the Madhyama Roga Marga that is mildly affected. If three or four joints are being affected, moderately is being affected. If almost all the joints are being affected, then the all the Madhyama Roga Marga is affected to the maximum extent. If there is affliction of a whole backbone, so that is when you compare the joints of the lower limb, feet, backbone is considered to be very, very important. So in that way, if backbone is being affected, then that may indicate severe form of Madhyama Roga Marga affliction. In that way, the extent of each Roga Marga type has to be properly understood by knowing about the concept of Roga Marga itself. And when you think about the pathophysiology, we should know the process of inflammation, what actually the inflammation is happening. So, what do you mean by cellular events? Or what do you mean by vascular events? And what do you mean by infective pathology? What actually the infection is being taking place on consumption of the what do you say that the adhyasana etc. on consumption of excessive sweet substances as such. And what do you mean by Starling forces? And what do you mean by Starling force? These are the forces or the pressure gradients happening across the capillary membrane. What actually happening? In what way there will be a possibility disturbances in Starling forces will happen? That has to be known. Sludging of blood. What do you mean by sludging of blood? And when do you say sludging of blood is abnormal? Because sludging of blood will be happening normally in healthy individuals also. When do you say it is abnormal? That should be known. And function of a body system. In what way the respiratory system is functioning? In what way cardiovascular system is functioning? In what way the musculoskeletal system is functioning? In what way the nervous system is functioning? In what way alimentary canal is functioning? That should be known. In regarding the coordination of the different systems, in what way the respiratory system and alimentary canal that is functioning coherently, in what way cardiovascular system and alimentary canal functioning coherently, in what way nervous system and alimentary canal is functioning coherently. So like that coordination of the different body systems has to be known. And in terms of the next thing, homeostasis and maintenance, how this homeostasis of the body is being maintained, that will be considered. So, when you think about this particular point of view, pathophysiology. Last point, when you think about the physics, chemistry, and biology. So, that is in what way the principles of physics will be helpful in understanding the concept of avarana. In what way the principles of chemistry will be helpful in determining the ahara parinama. In what way the principles of biology helpful in understanding the functions of hridaya. functions of Basti as such. Plus, we have to understand composition of human body and chemistry. What is the percentage of water in the inside the cells? How much percentage of solid matter present outside the cells, etc. That will be learnt by principles of chemistry and human body itself, and principles of Newton's laws of motion and Ayurveda. How to interlink these principles of motion, that is first law of motion, second law of motion, third law of motion, and that can be understood in terms of Ayurvedic understanding. So, like that, these are the different 8 areas where we are going to concentrate on the different areas where we are going to learn different aspects as self. So, how to apply this? When you think about the learning wheel, the center of the learning wheel is 0, and the periphery, that is the diameter of the circle, that is 10. If you think about the each area from 0 to 10, where you are going to stand on that particular area, so that will be giving us whether we are having the proper learning or not, or moderate learning or extraordinary learning can be said. For example, when you know about the area of a dosha, if you are thinking yourself, you are knowing up to 4 from 0 to 10, then that means you are having the somewhat a satisfactory learning. And when you think about the concept of Nidana, if you are having the 6, then comparatively better than the dosha. If you are thinking about the concept of Roga, that is indicative of the up to 1 to 0 to 10, you are having 3, then means it is this area you have to give much more stress. Then Rogi, so that is you are knowing 2, then that is 0 to from 0 to 10, then you have to give even much more stressor. That means this area you are having the unsatisfactory learning, you have to give more stress on that particular part. Then when you think about the terminologies, you are knowing only about the 2 out of 0 to 10, this area you have to give more stress on that. Roga marga, if you are having the 4 out of 10, 0 to 10, then you have to give comparatively the stress as such more stress. And pathophysiology, you are knowing very little, so that means here it is unsatisfactory learning. And when you think about the understanding of PCB and Ayurveda, if you are having the 3 out of 0 to 10, then also it is considered unsatisfactory learning. So like that, all these different 8 areas, we are having the exact point where we are lying on those different 8 domains of learning. So that means we are getting the clue where we are standing there. So this is how we can able to draw this. So that means the area where we are having the maximum learning is towards Nidan, where the next maximum learning is on dosha. The third next learning is on roga. The next learning is on roga marga. The least learning is on rogi. So like that, the maximum area where you are having the proper knowledge, so that is where you can move towards extraordinary learning, is at the beginning is in the area of Nidana. The next area is on the dosha. The third area is on the roga. So like that, this will be giving us the clue where we have to concentrate first. In the sense, the call to action. When you think about the call to action, so that is you have to know about these different 8 areas where you are standing in those different 8 areas. You have to rate yourself from 1 to 10 in all these different 8 areas. That has to be no. Then the next thing will be you have to start with the point where you are having the maximum satisfaction. From there, start your learning. Then go to the next point, then go to the next point. Like that, you have to continue the learning in all different 8 areas of Roga Nidana learning wheel. So here, in this particular small example, the area where you have to give more stress at the beginning will be in Nidana. The next area where you have to give concentration on dosha. The third area where you have to give the concentration on roga as such. So this is how you have to move when you think about the learning way. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video you'd like to hear in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.